Hey guys, it's Katie from RNSchoolofNursing.com. Today I'm going to talk about a very general overview of the blood flow through the heart, my favorite. Okay, so I'll use red and blue to show oxygenated blood and deoxygenated blood as it's traveling through the heart. Before I get started though, I do want to just point out a very simple fact that when you're looking at this kind of stuff in your textbooks, on a piece of paper, always keep in mind that when you're looking at it, this side is the patient's right side and this is the patient's left side. So we'll make a note of that. Just so there's no confusion during the spiel. All right. So, of course, when blood is traveling back to the heart from the body, we know it's going to the heart because it needs to be oxygenated again. So, how does it get there? Travels first through either the inferior vena cava or the superior vena cava. They're huge. And both are leading right to the right atrium. So we'll write that down. So this is where it first enters the heart. Deoxygenated blood enters the heart from the inferior vena cava, superior vena cava, into the right atrium. Then travels through the tricuspid valve down into the the right ventricle. As the heart pumps, it's then going to travel to the pulmonic valve, through the pulmonic valve, into the pulmonic artery, where it's going to travel to the lungs and then become oxygenated blood. So going to the lungs, turning into oxygenated. Not a very good artist. So at this point, this is where the exchange happens. So deoxygenated blood has now turned into oxygenated blood, has to come back to the heart, finish the process. So then it's going to travel from the lungs back into the heart through the pulmonic vein. So another point or fact that I want to point out is most arteries and veins, when you're thinking about other parts of your body, usually arteries are going to carry oxygenated blood away from the heart, so you can always remember artery A away from the body, and then the veins will carry deoxygenated blood to the heart. Well, in this instance, it's going to be the opposite, so something to keep in mind. So coming back again from the lungs, back in through the pulmonic vein, where it's then going to travel into the left atrium. Going through another valve, the mitral valve, goes through that into the left ventricle. From there, again, contractions occurring simultaneously with the right and left ventricle, right and left atria. Once it pumps the blood from the left ventricle, it's going to go through the aortic valve, through the aorta, and out to the rest of the body. So that is the blood flow through the heart. Very simple. I always say, always remember the basics. If you remember the basics, you remember your pathophysiology, you remember your anatomy, it's so easy to work through certain things. Especially when you're thinking about how medications are working, their mechanism of action. So when you can remember stuff like this, it's so easy to remember those other things, those more detailed types of things. So definitely something good to know. Definitely more tips to come. Please check out RNSchoolofNursing.com for more tips and tricks. Thank you.